Good afternoon. I do apologise for the delay, slight delay in starting today. We've just had a couple of technical issues at this side of the screen. But 2 weeks ago, I updated Islanders on our ongoing reconnection plans, and they included how we are prioritising physical and mental health, our children's education, our livelihoods, and our strong economy. Since then, we've seen under-18s return to outdoor sport, restaurants and hotels reopen, and singing in groups restart. Islanders are beginning to feel the rewards of their determination and adherence to public health guidance. Now we can move forward with that reconnection. Public health officials and STAC have spent the last 2 weeks creating proposals for a more detailed reconnection plan based on our updated vaccination and active cases figures. That plan has been designed to provide a cautious return to normality. And that is because it is designed to be a one-way route to greater freedoms. We do not want to restrict public activities again. We do not want to restrict your freedoms again. So we must have enough time between each stage of reconnection to make sure that it is safe and appropriate to move forward. The threat from COVID-19, despite our world-leading vaccination programme, has not gone away. Younger and unvaccinated people can still catch it. They can still suffer from its symptoms, and they can still develop conditions currently being explored under the name of long COVID. And we must take this seriously. But Islanders should congratulate themselves on getting us to such a good position and protecting our most vulnerable from the physical harms of the virus. Now is the right time to lay out our plan for greater freedoms, and we will continue to prioritise activities that are either low risk in their nature or can be made lower risk through mitigations and guidance. We will then move on to reconnect activities that bring the greatest well-being and economic benefit. So this means our plan will see the return of gyms, indoor gatherings and children's soft play before Easter. So just to be clear, that means from Monday the 15th of March, limited household mixing can begin. The plan will need to be flexible as we are relying on 5 objectives to guide us through the reconnection. Firstly, we must keep cases low enough to preserve our ability to test, trace and track cases and clusters before they become outbreaks. Second, any outbreak must be containable to prevent a surge of infection that will result in a third wave. And thirdly, our vaccine supply must remain as good as or better than it currently is, with evidence continuing to show that vaccines reduce hospitalizations and deaths. Next, we would want to see that there are no variants or mutations of COVID-19 presenting a risk to our vaccination programme. And lastly, our balance of harms approach must be maintained with the right reconnections happening at the right time and in the right order. By doing so, we can balance the risks from COVID against the societal, educational and economic harms caused by maintaining restrictions. I'm now going to pass over to Lyndon Farnham as Deputy Chief Minister, who's going to explain our reconnection plans in more detail. Lyndon.
Thank you, John. The reconnection roadmap agreed by ministers yesterday sets out the next 4 stages of progress and how we will return our community to normality as we finally beat the pandemic and head safely towards the summer. I'm going to run through the date and reconnection activities, but before I do, I want to be clear that these are the indicative dates for our reconnection. They will be subject to constant review by our scientific and technical advisors. However, we will consider bringing things forward should our situation stay as good as it is now, with high levels of testing, finding few or no cases week in, week out. The opposite is also true. If our situation deteriorates due to clusters or outbreaks, this could delay the reconnection. However, I am more than optimistic that these dates will hold and potentially improve, but we need to stick to the rules through the final stages of the pandemic. I know many of you are wanting to travel freely again to and from Jersey, and we are carefully considering plans for the reconnection of our island internationally through our safer travel policy and the reintroduction of our traffic light system for travellers arriving in Jersey. These plans are still under careful consideration by the Council of Ministers and subsequently will not feature in the plan I will be setting out shortly. Our borders are our key line of defence against the spread of the virus, so it is important that we take the time to ensure we make the very best decision, and to that end we will be providing an update on our safer travel and border policy next week or early in the week after. Moving now to our on-island reconnection plans. On Monday the 15th of March we will move to stage 4 of our roadmap. From that date, gyms will be allowed to reopen and indoor sporting activities, including changing rooms and swimming, can also resume. These will be under guidance which we will share in advance with the relevant sectors. Islanders will once again, as the Chief Minister said, be able to meet in each other's homes, up to a maximum of 10 people at any one time. Soft play facilities will open for groups of up to 10 children, and singing and the playing of woodwind and brass instruments in groups of 10 indoors will also be permitted. We will enter stage 5 on Monday the 12th of April. From that date, islanders will be able to return to workplace with some mitigation and physical distancing still in place. The outdoor gatherings limit will be raised to 20, with up to 40 for outdoor sports spectators. Close contact sports, including martial arts and rugby, can resume indoors and outdoors, and the drinks-only table service can resume in hospitality settings once again. Stage 6 of the reconnection programme will commence on Monday the 10th of May. From that date, physical distancing will reduce to 1 metre, and the physical distancing order will be discontinued and replaced with guidance. Working from home guidance will be lifted altogether, and islanders will be able to meet indoors or outdoors in groups of up to 20. The limit on indoor singing and playing of brass and woodwind instruments will be raised to 20, with an audience of up to 20. Weddings and wedding receptions of up to 40 people can take place, and wakes will also be permitted for up to 40 people. And finally, we will enter stage 7 of our reconnection programme from Monday the 14th of June. At this stage, physical distancing will end and large events will be allowed. Nightclubs will reopen for the first time in over a year, and live music and dancing will be permitted, alongside standing drink service. And also theatres, auditoriums and cinemas can be fully reopened. At this stage, we will also undertake a thorough review of all COVID-19 guidance and legislation. I would like to take this opportunity to highlight the business support packages currently in place. These include the co-funded payroll support scheme, the visitor accommodation support scheme, the visitor attraction and event scheme, the fixed cost support scheme, the business disruption loan guarantee scheme, and social security and GST deferrals. All of these support packages are under constant review and will remain in place to protect jobs and businesses through the transition period. I will be providing regular updates on these support packages throughout the reconnection roadmap. And I have absolute confidence that we can meet the key dates set out today. This is because our community has shown fortitude and commitment throughout the pandemic, and I know we all want to return to normality just as soon as it is safe to do so. Before I hand over to the Health Minister, I just want to pay tribute to all those who have been part of our excellent vaccination programme, not just the frontline workers who are diligently and efficiently delivering the vaccinations, but also to all of you who are participating in the programme to protect yourselves and others, without the vaccination programme, we would not be able to return to normality within the timescales and framework presented to you today. So thank you all. I will now hand over to Richard, who will provide an update on the vaccination programme and the success we are seeing in providing ongoing protection to our most vulnerable islanders. Thank you.
Thank you, Lyndon. The plans you have set out will be warmly welcomed across our community, and like my fellow ministers, I want us to be able to reconnect and resume normal life as soon as possible. But it is critical that we follow the stages set out in this roadmap so that we can move forwards proportionately and safely and avoid having to change course or even backtrack because of an uncontrolled increase in cases. Our vaccination programme is moving ahead at pace, and we have now delivered a first dose to more than 30,000 islanders. Among those who have received their first dose so far are almost 100% of islanders over the age of 80, 95% of care home residents and 83% of care home staff, and over 93% of islanders aged 70 to 79. And below those ages, we've so far had an 81% take-up of the vaccine amongst people at clinically high risk. These figures represent a comprehensive rollout to our island's most vulnerable people, and I want to thank everyone who has come forward to be vaccinated. Vaccination not only enhances protection from COVID in individuals, it also slows the spread of the virus in the community and reduces pressure on hospital and frontline services. But we must remember the vaccine reaches its maximum effect a few weeks after receiving a second dose. Most people will not reach that point for many weeks yet, and they will still have a vulnerability. So we must not think and behave as if we've beaten COVID. It's important, it's vital that we continue to observe the public health restrictions and guidance and follow the stages of the roadmap. And I ask all islanders to join together to keep Jersey in a safe place. From Monday, islanders aged 50 to 54 will be able to book an appointment to receive their first dose. And this will be the last group of islanders who will be vaccinated in phase 1 of our vaccination programme. I continue to be extremely proud of the progress the vaccination team has made in such a short space of time, and I thank them for their dedication, hard work, and the reassuring welcome they give to those receiving the vaccine. As we near the end of phase 1 of the programme, the vaccination team will be moving on to deliver second doses of the vaccine. Islanders over 80 who were vaccinated with their first dose between 10 and 12 weeks ago have begun to receive text messages or emails from the vaccination programme team with a date and time for their second dose vaccination. So if, when you booked your first appointment, you used the phone or email account of a family member, a friend, a parish or a charitable organisation, please contact them, as they're likely to have received this follow-up text or email on your behalf. And we're now starting to look ahead to phase 2 of Jersey's vaccination programme. Last week, the Joint Committee on Vaccination and Immunisation provided their interim phase 2 recommendations for vaccinating people under 50 years old. We are currently reviewing these recommendations to help inform the next stage of the vaccine programme for Jersey, and details of this will be announced in the coming weeks. I'll now hand over to the Chief Minister to sum up and take questions from the media. Thank you very much.
Thanks, Richard, and thanks, Lyndon. So I want to close by asking you all to picture a typical summer day in Jersey. The sort of summer that we used to have without the restrictions we've seen over the last year. This is the type of summer that we could have this year. One where we know our vulnerable friends and family are protected by a vaccination regime that has rolled out successfully across our community, and one where COVID is not the topic of every newspaper, radio or TV show. You have the power to make that summer happen, but it can only happen with your cooperation and absolute commitment to the reconnection plan we have set out. Relying on wishful thinking or rushing through the stages we've outlined will put that summer in jeopardy. I'd like to reiterate that Stage 4 reconnection does not start until the 15th of March, and it's important we continue our adherence to the current guidance until that point. The finish line is in sight, but we cannot disregard the mitigations and public health guidance in place or make the mistake of sprinting towards the end. We all need to cross that finish line together in a way that ensures that we no longer need restrictive measures. Thank you all for all you've done so far and for all you continue to do as an island to combat COVID and reconnect our community. I'm now going to ask the media for their questions, but thank you for listening. Okay. So, we have Charlotte from the BBC, we have James from the JP, we have Elodie from Bailiwick, we have Gary from ITV, and we have Harry from 103. And Gary has returned from the beach, I understand, from his broadcasting for the other night. Okay, so we'll start in that order, and we'll go for Charlotte.
Hello. So obviously we're approaching the Easter holidays, which is typically a busy time for people to go out travelling. What process, or is there any kind of discussion going on at the moment for an air bridge with our friends over in Guernsey?
I'll do a high level and I'll hand over to Lyndon. So the high level, I think, is in general travel terms. We've said that to date there's no planned change before the end of March, but we are doing a discussion at both competent authorities and next week with council ministers on travel, and then we'll make some announcements later. And obviously part of that deliberation will be the kind of areas you talked about for Guernsey. Lyndon, do you want to add anything?
Thank you, John. Officers from both islands have been having very positive discussions. I spoke to Deputy Peter Fairbrush last night, Guernsey's Chief Minister, and the political will is there on both sides. If it can be achieved, we would very much like to do it. I think it would provide a really good opportunity for islanders from both islands to get off and visit the other island. So there are details still to be finalised, but it's a work in progress and hopefully it can be achieved.
Great, thank you. I'm sure that would be a very welcome move for a lot of people. I know obviously you spoke about the under 50s and vaccinating under 50s. What deadline do you want to get all islanders vaccinated by?
Richard or Ivan, do you want to expand on that?
All islanders
By the we hope to vaccinate most people eligible for vaccination. That's obviously over the age of 18 by the 1st of July, hopefully, possibly a bit later, but it's of that sort of order.
Okay.
That's the first dose, isn't it?
Yes.
Do you want to add?
Sorry, that's the first. All people will be receiving the first dose by then.
Okay, right. James, JP.
Thank you and good afternoon. First, just want to touch on the borders, obviously a hot topic, and certainly when you compare the figures to when we saw them drop last year, we seem to be taking a more hesitant, perhaps cautious approach, and I just wondered why that was the case.
I'll give the high level. I'm sure I'll hand over to the people off to the right. But so essentially, we did say in the beginning, in January, that the reconnection would be at a cautious approach. Obviously, the new factor here is making sure that we can get everybody vaccinated on the time frames that we're talking about. And in order to receive that vaccination, we want as many people well as possible in order to be able to receive that. But I don't know if anybody wants to add to that.
So, as has been indicated, one of the priorities now is to ensure that the vaccine rollout program is not interrupted by infection, and we need to tread cautiously to ensure that that doesn't happen, because that's our chief response to COVID. The second is, of course, we know that the Kent variant is here, that is more transmissible. And we want to give ourselves plenty of time to be able to pick up any uptick in infection, to respond rapidly to prevent that uptick becoming a threat.
Okay. Second question.
Thank you. And just in regards to our final roadmap date, I know certainly there's a bit of hesitation to compare jurisdictions, but I'm sure many islanders thought that we would have perhaps a sooner date than the UK, June 21st. So I wonder if you think we're taking a conservative approach in that, given that it's only, 7 days removed from the UK's final date.
I think we've always tried not to get into that comparison point. We've put out a roadmap which we think meets the caution around the vaccination program that we're dealing with, but also gets us back as quickly as we can in as many measures as we can. I think that's really all I can say at that point, is we match each profile to where we are. And obviously the other crucial thing is, as we go through, is we'll be very carefully monitoring the results, and obviously that program can be adjusted as we've gone through. And the crucial thing there is, you talked about it being cautious, but obviously if we don't see the numbers in the right place, then potentially you do actually slow down. So we've just got to make sure, this is a roadmap, but we will be monitoring each stage of it as we go along.
Thank you.
Yeah.
I wonder if I could.
I think that's probably enough. Yeah. Okay.
Okay.
Right.
All right.
Okay. Yep. Second question. Sorry, Elodie.
Hi, good afternoon. Cases in Jersey are heading towards zero, yet we'll have to wait another 3 months to see most activity fully return. How do you plan on maintaining support from the public over the next 12 weeks, given that public confidence in the plan is critical to its success?
Well, what we've said is as well is that it's important. The new variable, if you like, in the whole reconnection program is the state of play vis-a-vis the vaccination program. And so that's why we are doing we've always said it'll be a cautious approach. The other variable, as Ivan has just referred to, is the existence of new variants, and making sure, therefore, that as we slowly re-engage, and don't forget, it's not that long, relatively, that hospitality has been reactivated, both at the restaurants and the hotel stage. And we've got to make sure that as that reconnection is taking place, it will probably mean that there will be some more cases. We don't know. We've just got to make sure we understand how those things change before we then go through the next stage, because we want to be as clear as we possibly can. The objective here is not to have to go backwards and not see a surge that we have seen in the past. If we do see a change in numbers, we will have to react accordingly. But we hope, therefore, by taking a cautious approach, we can avoid that and get as many people vaccinated as possible. Either Lyndon or Richard. Yeah.
I think I understand islanders will be looking at the figures, looking at the success we've had in recent days and weeks, and asking why we are being quite cautious. And I think the key point is that we want to keep going forward. We don't want to have to move back. Now, I know Dr Muscat and I might be at a slight juxtaposition, because we've had very healthy debate about this going through, and we listen to the advice very carefully. But I would very much hope that we would be able to bring some of those dates forward, subject to a continuation of the very good figures we're seeing now. Hospitality has been open for almost 2 weeks, 12 days, and there has been little or no impact. Numbers have continued to fall, and I think that's a very good sign. And of course, the next stage with gyms and household mixing, the following 2 weeks after that, I think 2 to 3 weeks after that, are going to be crucial. So I'd like to be more optimistic. I will continue to work closely with my colleagues and keep challenging on behalf of the economy and islanders, and hopefully we can continue to find that balance.
Richard, do you want to add something?
Yes, like Lyndon, I'd like to be optimistic, but we must also be realistic too, and let's not be surprised if we do see numbers increase, because we've got to this good position we're in at a time when the island has been largely closed. People have not been mixing in sports and in restaurants, hospitality venues, and it's brought us, thanks to islanders' efforts, to this place. There's nothing COVID likes more than people gathering together. But we need to, because we are social animals, and we want to restore that normality. But we must not be surprised if it does result in numbers increasing, and the challenge will be to control those numbers and return ourselves to through the roadmap to that degree of normality. So it's that careful balancing exercise. So please don't expect to see numbers stay in single figures and go to zero. That we will be managing the numbers, but they may be greater than they are now. Thank you.
Okay. Apologies.
Question?
Yes, I was going to say, I was trying to remember if that was your first question or second question. I think that was your second question, wasn't it? Right.
It was my first one.
Oh, it was your first one, in which case I didn't put a tick next to your name.
Yeah.
Right, go for your second one.
So, Benedict Express recently spoke with someone suffering from the effects of long COVID, who is yet to return to full health, having caught the virus at the end of October. She was officially declared well 14 days after a negative test, but that clearly isn't the case, and she's not the only one in this situation. What is the government doing to ensure that GPs are fully aware about the latest thinking on long COVID? What is being done to treat it, and what support structures are in place for sufferers of long COVID?
I'm definitely going to pass that question down to our medical people, Dr. Muscat on the right.
Thank you. You're absolutely right that the long COVID is an important topic and one that needs to be addressed, and we have formed a working party which has met both formally and informally over the last few weeks to ensure that there are structures in place to address long COVID, to ensure that GPs and other doctors and healthcare professionals as a whole are aware of this and what to look out for and what the referral pathways are to manage these situations. The presentation of long COVID can be quite variable, and we are aware of this, and we will be making sure that people are referred to the right specialties to ensure their optimum care. But it is very much on our agenda, and we are pursuing it, and we should, those referrals can happen as we speak. We're just making sure it gets better and better.
Okay, thanks very much. Gary.
Can I, Chief Minister, can I just add one thing? The most important thing to manage, to allow us to manage long COVID well, is to vaccinate as many people as soon as possible to prevent COVID in the first place, of course, and we are very mindful of that as well.
Okay. Gary.
Chief Minister, hello. Now, your roadmap and the dates rely on the expected number of people getting vaccinated. What's your projection as to how much this roadmap will be delayed if not enough people do turn up for these vaccinations?
In terms of people turning up, and I'll definitely hand off to my right again to Ivan and Richard for any detail, but my understanding to date is in terms of the number of people turning up, lots of people are turning up. It's being driven by the availability of the vaccine, not the willingness of people to take part. I think that's the important thing. And I please emphasise, please keep doing that, because, as Ivan said, the more people that get vaccinated, the better. I don't know if anybody wants to add.
Yes, I don't yet anticipate a scenario when people will, in numbers, decline the vaccine. We've had an excellent take-up, and I thank Islanders for their confidence in it. It's a rightly placed confidence, and that, I'm sure, will extend to people below the age of 50. Thank you.
Okay. Second question.
Yeah, my second question for Dr. Ivan Muscat. We know, because obviously some of the minutes have been published, that parts of the STAC advice on border controls last year was ignored multiple times. Ministers meeting on Tuesday to discuss reopening borders. What's your advice been to them? And could you touch on vaccination passports? Because I know the idea of those is very much on the table for consideration.
So we know that travel is potentially the more complex part of the roadmap and is potentially one of the more precarious parts of the roadmap in relation to reseeding Jersey with COVID and variants. Whilst it has to be closely linked into the internal fluidity of Jersey, because of course if you seed a fluid population, then spread will be pretty fast. We are approaching it carefully and slowly, so that it is as low a risk as possible while still viable. In terms of passport immunity, I think there are two ways of looking at that. One is in terms of a certificate of vaccination, if you like, and the other is a COVID safety passport, which would be this an immunity certificate plus appropriate testing to cover the actual period of travel. Both are being discussed, but both need to be the meaning of the immune certification or the safety passport. That needs to be agreed internationally. There's no point in us saying this is what it means to us, because we can't impose that on other countries. We can't say, you've got an immune passport, you can go to whichever country you want to. The receiving country must be in agreement. So both are being worked upon, not just in Jersey, but in other countries, and everyone is very keen to try to provide a slick and reliable service to enable safe travel.
Okay. Harry.
Thank you very much. Senator Farnham, you mentioned the business support packages that are available. I wanted to ask about the visitor attractions and events scheme, because I think it was a week last Friday you spoke to Scrutiny and said that there was only 3 applications, I think, to it, and about £30-something thousand had been paid out from a scheme that had £3.5 million in it. You've given the date for nightclubs possibly to reopen in mid-June, but obviously a lot of them haven't got financial support from the specialist scheme that's been set up for them because the criteria has been way too strict. Has any work been done to make it less strict? For example, the minimum turnover of £300,000 or the having to be GST registered. What can you say on that?
Yeah, thanks, Harry. Ministers agreed on Wednesday to accept the proposals to soften slightly the entry criteria to the scheme. I haven't yet, we've just finished the detail today. I'll be communicating that to the sector over the weekend with an announcement on Monday. But in short, yes, we've agreed to remove the GST requirement, reduce the threshold, the turnover threshold, from 300,000 to 150,000. We've also agreed to reduce the detriment requirement from 50% to 30% and remove the requirement to have applied for the bank loan guarantee scheme. That's in alignment with the other schemes. So we're going to backdate that to the beginning of January. So I'm hoping that will bring a lot more businesses into the scheme and we can start getting some of that money out. We freely acknowledged, all the ministers acknowledged, that the first scheme we put forward, the criteria was slightly harsh, and that was borne out by the fact that very few businesses managed to qualify. So hopefully this will bring a lot more people into the scheme.
Brilliant.
Okay.
Thank you.
Second question.
Before I move on to my second question, can I quickly ask, related to that as well, because the fixed cost support scheme is available for them in many other industries. That's, I think it was about a month ago that opened. Can you tell us any information on that? How many applications that you hinted before that in the same meeting that a lot of applications have been made to that scheme? Do you know how much has been paid out so far on that?
Sorry, which scheme?
Fixed cost.
Oh, fixed. So far, the fixed cost scheme, my latest information, 148 claims, having paid out just over £308,000. But that's starting to pick up some momentum as well, which is good news.
Brilliant, thank you. And my second question is there a time frame in mind as to when we possibly might not have to wear masks anymore?
So I'm just looking at my notes. Yes, actually, sorry, no, it's true, because we've kept, for the moment, we've kept the masks in, and obviously we'll reevaluate that as we go further along. So there's no definite decision as of today as to when that's going to be reviewed.
Okay, is there any, I mean, obviously the order's in place, so is it just going to be one where I'm just thinking with case numbers being so low, and I assume it must be before the June date when the last lots come in terms of, say, places being open, because I'm sure it'd be difficult to have to wear masks when you're going into these sort of venues, or is there any sort of idea, or has it been discussed?
I think at this stage it's just too early to say it's going to be such and such a date, because it will again keep depending on what the advice is that we get from the medical perspective. So at this stage it's just too early to say, because again the whole point is as we're saying, as we open up and as people mix, what's the issue around risk and spread of the virus, and if one of the wider mitigation measures we've got in place is about wearing masks, then that may well stay for a little while longer. So at this stage I can't give you a definitive date. I think unless Ivan want to add anything, but I think that's it.
What the Chief Minister is saying underlines the importance of using metrics, both in terms of infection rates and vaccination rates, both in Jersey and outside Jersey when the borders are open, in determining the rate at which we go down the roadmap and the rate at which we lift NPIs, and that includes when and how to use masks.
Okay, now I'm acutely aware we did actually start late, so actually we've only been going for 30-35 minutes. What I'll do is I'll do one very quick whiz round of one question each, and Harry, that's one, that's not one and three supplementaries, and in fact we'll go from that. Now I don't know if Charlotte's in there still or not. If she, no, right, she's gone. Okay, so James.
Thank you. Yes, I just wanted to touch on, obviously the news today is very reassuring to many islanders, but perhaps it was news that they heard prior to certainly this conference, and it spread like wildfire on Twitter. I just wondered if that was going to be looked into at all, just another key announcement that people have seen on their phones and laptops before an announcement on the television.
I think we would always like to try and track down leaks when they take place, and where we've been able to, we have tracked down some in the past, and we'll see what comes out of this one. It is, I will just add actually, it is always disappointing when we do give briefings to individuals ahead of a press conference and then it does get leaked out. Sometimes it's been accidental, and that I can understand. Others, particularly when you give a confidential briefing, but I guess that's the nature of social media these days, and we'll see where that goes. Okay, Elodie?
Yes, with case numbers low and the vaccine program going well, it seems like a good time to decide how we rebuild our economy. What fiscal stimulus projects have been agreed so far, and what areas of the economy are they focused on?
So in terms of fiscal stimulus, I can't give you details yet. My understanding is that the first wave of announcements are going to be released quite imminently, and you'll see where they are. And obviously, in the wider context, as I've previously said publicly, there is money for longer-term economic recovery in the government plan, spread over 3 years. So there's longer-term money there. We have got some of the shorter-term fiscal stimulus measures are actually already in place. So we had to reduce social security rates, as you recall, in October, and that carries on until June. And also, we are talking, as you will be aware, various infrastructure projects, including, for example, next door to where we are at the moment, Cyril Lamoko House, and that is shovel ready, basically, i.e. all the tender process has been done, all the due diligence has been done. We are ready to sign a contract on Monday week, subject to the conclusion of the 15 days. And that obviously is very important to people's jobs in the construction industry. It's very important, generally to the firms behind all that lot, to the subcontractors, and obviously in the wider context, the very long-term savings that come out of those sort of projects. That particular one is worth £7 million a year to us as taxpayers. So there are schemes in place. What I'm saying is that some of the expenditure that comes through the government plan is there and will support the economy going forward. And that has been part of our thinking of developing what you might call business as usual, the big structural things that we want to do some changes on. There'll be some other announcements coming out, hopefully in the next couple of weeks as well, which will also assist in that area.
I understand you can't give details about the projects, but can you maybe tell us what areas of the economy they focus on?
On the fiscal stimulus, I can't, because it was bids that came in from a wide range of areas, and there's been a process that has then gone up to the Treasury Minister. So, as I said, that will be coming out, I believe, imminently.
I mean, if it's helpful, the sorting process will. Once the shortlists have been brought up, that's when it goes to ministers. But I understand there's a really broad section of applications, from sport to heritage to other general infrastructure, all of them aimed at getting money into the economy this year.
Yeah. Yes, actually, that is the crucial criteria is the money has to be spent this year, as far as humanly possible. So, as I said, announcements coming imminently on that. Gary.
Thank you.
Can you just give us an idea of when we all need to start worrying? Because I think people need to understand there is an expectation there will be some more cases in the coming days, weeks and months. And perhaps people will have jitters at 10 or 20. Obviously, you don't want anything like the shambles of December we saw with isolations, people sick, hospital overwhelmed and 37 additional deaths. What's your metric as to when we should start thinking, uh-oh?
As ever, I'm not going to give you a number because people fixate on a number. I want to challenge, and if I'm rephrase that, I'm going to look at Ivan to check if my memory is correct, but I don't recall the hospital being overwhelmed in December. The numbers went up, but the hospitalizations, when I say stayed consistent, they stayed at a manageable level. Is that fair?
I think it's true that the hospital wasn't overwhelmed, but certainly some procedures were delayed, but it wasn't overwhelmed as such. But there was an effect on the health service. But then that's what pandemics do.
So, and again, I just reiterate the point which we've said previously, is that although the numbers went up a lot, and as we know, we went up to, I think, just over 1,000, it was that point, and Ivan has said previously, and hopefully he'll nod also at this point in the minute, is that in March of last year, for every positive, there were 10 out there that we didn't detect and didn't know. This time round, for every positive, there were only 2 or 3 out there that we didn't detect and didn't know about. So therefore, we were capturing a lot more and a lot early. So it goes back to that point. We know lots of numbers. The numbers went up. They went. The acceleration was high. That's why we took the action that took place. But we've also got to really keep stressing you cannot do a direct comparison between the sort of over 1,000 in December and the hundreds, as it were, that happened in March. They aren't directly comparable. But in terms of metrics, that's why we said there are a variety of conditions, if you like, that we will consider at each stage as we progress along the roadmap.
I think what I was just getting at, really, if I can be cheeky, is that because the vast majority of those at greatest risk of hospitalisation and death in the next few weeks will have had their first jab, I'm just wondering if you can explain to people to explain that a higher number of active cases is probably more okay this time around because of the difference, or is it not? That's really what I'm trying to get the gist of.
Richard.
It depends where they arise. If we have 10 cases arising out of a cluster, and we can bear down on that cluster, identify those people, and control it, that's okay. We'll do that. If we've got 10 cases that are randomised and we don't know how they've arisen, and they're all over the island, that's more of a concern. That indicates a greater spread and a greater risk. So it depends on the nature of the cases we will see. That's why tracking and tracing is so important, and why when we're out and about and we're required to leave our name and contact details, we must do so. So, it's so difficult to say, watch out for this threshold, because it's not. It's just taking day by day, taking a view on where we are and the risk factors that we're facing. Thank you.
Can I just add something? I think Ivan might but what very encouraging news is that, I think Gary might have touched on it, that I think is it over 80% of vulnerable islanders that have now been vaccinated? The most vulnerable?
Yes, 83% of the high-risk people have had their first dose, and 81% of the high-risk people aged 16 to 69 have been vaccinated as well, have had their first dose, and the very high risk people, and moderate risk people, about 65% of those have been vaccinated so far. But I think you're right to people are right to emphasise that it is not just one number that actually determines the decision. So it's the number of infections. We've now moved on to also distinguishing between infection and disease, because vaccination prevents disease, and it prevents disease now largely in those most at risk, because that's the group we started to vaccinate. So that needs to be taken into account. The rate of change of these numbers also needs to be taken into account. The explicability of infection, as the health minister mentioned, needs to be taken into account. The rate of vaccination, where we are with vaccinating the population, needs to be taken into account. And of course, where we are on the roadmap needs to be taken into account. If the next step is a very precarious step, one which will catalyse the transmission of COVID hugely, then that too needs to be taken into account. So it's a collection of items that needs to be put into the crucible to help us make a decision.
Okay. All right. Thank you, Gary. And thank you, Ivan. Harry, last question.
Thank you. Can I just ask about gyms? Obviously, a lot of people were quite upset when they were obviously closed down at the end of last year. Can I ask why you've decided to wait until a week on Monday to allow gyms to reopen? And will the guidance relating to gyms be any different to last year to prevent any such clusters that appeared last year that led to gyms closing in the first place?
In terms of the details of the guidance, I can't comment on that yet. I think it's in the process of being finalised. That's why we're giving a little degree of notice to allow that to be put out there as well. In terms of timing, as we've said, it is being done effectively on a risk-based approach, and essentially it's felt that this was the appropriate time to introduce gyms in this block, as it were. But what we're doing by doing it on March the 15th, as in that being the next date, it is taking account of the return for adult sport from Monday, but probably most particularly is leaving a decent gap between hospitality going back and kind of that next level of risk coming back into the community, if you like. So that's the reason it's going to be the same all the way along the line. We've got to stagger it to allow the previous measures that we've released to settle down the community, to assess that response, and then to go on to the next, hopefully the next relaxation. Okay. I think on that note, we will bring matters to a close. And if I can just say, as we close today, I would like to thank members of the media for your questions and to thank all of you for watching. So the roadmap we've set out this evening charts a clear course of reconnection for our island, but it is dependent on us. And islanders have already shown great resilience and responsibility over the last 12 months, and I want to urge you all to continue following the guidance, to avoid complacency, and to not take unnecessary risks. We are close to securing the summer that we all want. Thank you for all your efforts so far, and let me wish you all a safe and pleasant weekend, and thank you for listening this afternoon.